let's talk about infection control for the NCLEX exam. Now, when it comes to infection control for the NCLEX exam, NCLEX wants you to know this: the 4 levels of precaution. That's what NCLEX wants you to know. The 4 levels of what precaution. Let me list them out real quick. We have standard, we have airborne, we have droplets, and lastly we have contact. Now, before we go into this, let me give you a practical example. So I'm going to put some things on the screen real quick. Right? Let me put some things on the screen real quick so that we use this to understand. Now, so we have 4 level right here. 1, 2, 3, 4. Now, this is a group of 1, this is a group of 2, this is a group of 3, this is a group of 4. Now, if I put this number on the screen right now, 4, and ask you to group this or place it in a group, I mean, now you are definitely going to place it right here. If I tell you 2, you are definitely going to place it right here. If I tell you 1, you place it right here. If I tell you 3, you place it right here. You cannot place 1 here, because that is not the right group. For 2 as well, you cannot place 2 here, you cannot place 2 here, you cannot place 2 here, because that's not the right group. For 3, you cannot place 3 here, you cannot place 3 here, you cannot place 3 here, because that's not the right group. For 4, you cannot place 4 here, you cannot place 4 here, you cannot place 4 here, because that's not the right group. So that is the same thing NCLEX wants you to do related to these 4 levels. So let me write the levels out again: standard, airborne, droplet, contact. Right, so we have these 4 levels. So on the NCLEX exam, you will see infection. Like right now, I gave you numbers and I asked you to group it. But on the NCLEX exam, yeah, you will see infection. Right. So the NCLEX can give you the name of the infection, or they give you the sign and symptom of the infection. Right. Is it that the NCLEX give you the name of the infection or sign and symptom of the infection? Now, for example, let us say TB, tuberculosis. That's the name. Sign and symptom, night sweat. Right, you see? Now, this is the sign and symptom, this is the name. So NCLEX can either give you the name or sign and symptom. Right. So now, but your whole duty on the NCLEX exam is to group this. Either NCLEX give you the name or sign and symptom to one of this level. The same way you were able to group all this I gave right here to one of these level, right? That's the same thing. So now if NCLEX give you TB, right, obviously this is the group. If NCLEX give you massa, right, obviously this is the group. If NCLEX give you influenza, obviously this is the group. If NCLEX give you hepatitis B, obviously this is the group. If NCLEX give you HIV, this is the group, right? If NCLEX give you chicken pox, this is the group. If NCLEX give you C. diff, this is the group. You see how it works, right? You see, I have the ability to group any infection. If NCLEX give me, let's do sign and symptom real quick now. Let's talk about night sweat. If NCLEX give me night sweat, right? I know this is the group, because night sweat, I need to interpret night sweat. In my head, I'm like, oh, night sweat is TB, because night sweat is TB. So I'm like, oh, that's the sign and symptom of TB. Then instantly I'm thinking airborne. If NCLEX is giving me red eyes, in my mindset I'm like, oh, red eyes is related to conjunctivitis. Then conjunctivitis is contact. Then I'm placing it related to contact. You see? Right. So now this is your first lesson, right? Now let's recap. You need to know the 4 levels of precaution, right? Which are what? Standard, airborne, droplets, and what? Contact. So we both agree that you know this right now. Now, what is missing right now is to know the infection, the list of infections, right? And you need to know it related to their name and what? Sign and symptom. That's what you need to know. Now, but the problem, no, let me not say the problem. This is not a problem, right? Or let me just say the problem most students might be having right now is this. Most students might be saying, oh, so do I have to know the sign and symptom related to every infection? The answer is no. You don't need to know the sign and symptom related to every infection. You just need to know the sign and symptom related to common infection. Right. And this is not something you need to do by yourself, because I've done all the whole process for you. Now, because this is the problem, right? The problem is a lot of students know the 4 level of precaution, but they don't know the infection that fall under each of these level. Now, this is number one problem with most students, right? They know the 4 level. If you ask them, list the 4 level of precaution, they can tell you standard, airborne, droplet, contact. But if you now tell them, where, if you ask, where does TB belong, right? They might tell you, oh, I'm not sure. Is it droplet? Is it contact? You see, that kind of student, right? The problem they are going to face on the NCLEX exam is this. Now, let's say NCLEX is testing related to the 4 level. We have standard, we have airborne, we have droplet, we have contact. And NCLEX now give you TB. Now, the moment you get the placement wrong and you say TB is contact, guess what? You will be forced to apply contact precaution to a question that you should apply what? Airborne precaution. Now, when you apply contact precaution to a question that you should apply airborne precaution, because this is the right grouping, but you place it in the wrong group, you apply contact, then you get that question wrong. You see, this is what can happen when you group the infection wrongly. So that this is why I want to fix this, right? I want to fix this for you. I want you to start learning where each infection fall under. So I have this PDF document. If you check below this video, the PDF document is there, right? I have put all this infection in their group, right? I've listed infections that you need to know related to standard, the one you need to know related to airborne, the one you need to know related to droplets, and the one you need to know related to contact. I have placed them in each of these levels. So now you need to start knowing them, including the sign and symptom as well. So remember I said you want to know the name and also the sign and symptom, because sometimes NCLEX will not give you the name. NCLEX will just give you the sign and symptom. So you need to be able to identify, oh, this sign and symptom is this. So from there you can be able to now place it in the right level. So what you are going to get from this PDF, you are going to get the list of infections, right, related to each level, right, and then also the sign and symptom related to what, each level, right? So that's what you are going to get, right? The list of infection by the name, right? And you're also going to get the sign and symptom. So that's what you need to start with right now. So the moment you are able to now know how to group them, such as what we did right here, the grouping. The moment you now know how to group them, the next step is now to apply the precaution, because now NCLEX is now like, oh, uh maybe your question is like, you are caring for a client who have what? Your question is like, you are caring for a client who have TB. So you're able to group TB to what? Airborne. So since you're able to group TB related to airborne, now you now need to apply that precaution towards that question. So the next step is you now need to now know the precautions, because there's one thing to be able to group to a particular level, and there's another thing to be able to apply the precaution. So you want to be able to group to the level and also apply the precaution. Because if you are able to group and you don't even know the precaution, it makes no sense. You are still not going to be able to answer that question correctly, right? So you want to be able to group to the level. That is one win, because now one win we have currently now is that we know the 4 levels of precaution, right? So we know this. So this one win. Now let this be our second win right now, the ability to now group the infection or sign and symptom to the level. So this will be our second win. So our third win will now be uh the ability to apply the precaution, because now when you are able to group TB to this particular level, which is airborne, and the NCLEX is not testing you about room and you don't know the room, right? So it makes no sense, right? So because at the end of the day, it's like you've wasted your time. You only know how to group, you don't know the precaution, you don't know the room. Right. So this is what we are going to learn next. But for now, this is what you need to do. Right. So get that PDF document now. Check below this video. Get the PDF document. The PDF document, I have placed each infection and sign and symptom to the level they belong to. So this is what you need to start learning now. So once you are done with this, then you need to move on to the next video where we talk about the precaution. And guess what? The same way you're able to understand this clearly, that is the same way I will make sure you're able to understand the precaution. So I'm going to see you in the next session.